Hi, my name is Sarah Weiss. This is my 321 CIS final research project. The research I came up with was AI in healthcare. I was super excited to research this one because I'm super interested in healthcare and I want to go into pharmaceutical or medical device sales. So I was really interested to see kind of everything that AI had to do or help out with, pros and cons within healthcare. So, this is my just introduction of AI in healthcare overall. I thought I would start out with explaining a definition of what AI in healthcare really is. So, AI in healthcare refers to the use of artificial intelligence technologies to assist in many different medical tasks such as diagnosis, treatment planning, patient care, drug development, and more. It involves machine learning, natural language processing, and other AI technologies. So, the primary focus is enhancing efficiency, accuracy, accessibility, and healthcare delivery. So, this is just kind of an overall explanation of it. And I'm going to tell you a little bit more of deeper dive into what it's actually going to look like with helping machines, doctors, and more. So, I have 6 key appliances that I'm going to be talking about. The first one is medical imaging and diagnostics. AI would analyze x rays, MRIs for disease detection. So, this would kind of be helping them look at x rays, MRIs, and seeing if other stuff maybe that doctors would miss, kind of taking a deeper dive into what is going on into the patient's body. And then my second one is predictive and analytics. AI models forecast health risks for early intervention. So this would be something that maybe a patient went in, something they were having some symptoms, and AI would kind of have a different look on what could be going on that could be a possible health risk to maybe solve it right then and there instead of happening later in the future. And it could be something that maybe a doctor missed. And AI could help with having a different look on it before it led to something like cancer or something worse. And then my third one is robotic surgery. So AI assisted would assist in surgeries. So a lot of the tools that surgeons use when they're about to perform, when they are performing on the patient, AI could help a lot with that, with maybe certain things they use. This really interests me because I'm someone that's super interested in medical device sales. So AI could help with either also the medical device person and also the surgeon, telling them what tool to use on the surgery or kind of more about it so they actually know what they're going to be doing on the patient instead of just being like, oh, this is super good, you should use it. And I would kind of give reasons why they should be using this tool on the patient in the surgery. My fourth one is healthcare administration. AI streamlines paperwork and patient management. So with everything going on in AI, this kind of helps do a lot of some people's dirty work, or not dirty work, busy work, and kind of overanalyzes everything so that it can be done faster. My fifth one is drug discovery and personalized medicine. So AI would help with faster drug development and tailored treatments. So AI could maybe say tell a medicine that would actually have a better effect than something that maybe the doctor has prescribed and have a different insight of maybe why that would be a better medicine for the patient to use. My last one is virtual assistants. And so my last key appliance was having a virtual chat AI kind of robot that you could talk to, tell them about your symptoms, maybe what's going on, so that they can help you find out maybe what's happening, because sometimes it takes a while to get into the doctor's office or that kind of thing. But that also kind of goes hand in hand what I'm going to be talking about on this slide, which is my advantages and disadvantages of AI in healthcare. So my first advantage is it's faster and more accurate. AI can quickly find health problems that might take doctors longer to spot. So a lot of times people go to numerous doctors and they get told different things. And it kind of takes a while for them to figure out what's actually going on. So this could help with an AI. They can spot it easier, faster, and not have patients kind of have to wait that long and type thing. My second advantage is fewer mistakes. AI can help reduce human errors during tests or surgeries. So, I mean, humans are humans, we make mistakes. AI is pretty prone to known that they're pretty accurate. And so you could get something more accurate than maybe a human sometimes. So that would be a really great advantage for hospitals. My third one is better access to care. AI tools can help more people get medical advice even in remote areas. So this also kind of goes hand in hand with what I was talking about with virtual, talking to a virtual AI person, telling them your symptoms instead of waiting to go to the doctor's office. My last advantage is it saves money. AI can help hospitals run more smoothly and cut down costs. There's a lot of things I was talking about with paperwork that a lot of places aren't really needing those type of people anymore because AI can do that, and then the hospital isn't having to pay for those employees anymore. So now I'm going to get into the disadvantages. So my first disadvantage is privacy issues. AI needs patient info to work, but that info is personal and could get in the wrong hands. So if you're just telling a lot of things to AI, they kind of start to know you, know the person, and that could kind of cause some things. My second disadvantage is unfair results. If the AI is trained on bad or limited data, it might make wrong or unfair decisions. So this would have to be a very well robot if it's going to be in surgeries, if it's going to be getting a lot of data. It can't be getting it mixed up with other patients and other things that are going on within the hospital. It would have to be really, really good and accurate, because that would end up with unfair results and could cause a lot of issues. Then my last disadvantage is too much trust in AI. Doctors could start relying too much on AI and stop double checking things, which can cause a lot of issues. That's one of the main disadvantages that people will talk about is over-reliance on AI. And you really don't want that in a hospital because we're talking about human lives. So that's why we wouldn't want too much reliance on that. And then the future of AI, again, like I was just talking about, too much trust in AI, that would not be good for their judgment. And sometimes, I mean, I've gotten over-reliant on it sometimes, and you have to realize that people are still smart and you just want different perspectives. So we don't want to become too reliant on it. Not fair for everyone. Rich places get AI, help poor places might not. So this could kind of come in a problem with hospitals. Obviously, we know of a lot of hospitals that are super nice in a great city, in a great place, so that they might have more money to spend on these really nice AI chatbots and robots in surgery, and people could start getting upset because that could take away business from other hospitals. Hard to understand. AI makes choices, but no one really knows how or why. This could be something that doctors would have a problem with, because maybe the AI chatbot would come up with something and the doctor really doesn't understand it, doesn't know why, and that could cause some stuff. Different rules everywhere. Not all countries follow the same rules for AI medicine. Like I said, that could become a little unfair and people could get upset about that. So my take on AI, the future in AI in healthcare is promising if it's implemented ethically, inclusively, and with proper oversight. So a lot of the advantages and pros I had, I really think would end up really working out and helping hospitals and healthcare in the long run. There are some disadvantages that we would definitely have to work through and talk about, but I really do think it would be in everyone's best ability if we did start including AI more in healthcare and hospitals, for all the reasons I just talked about. Conclusion of my whole research in AI and healthcare. AI has the power to revamp healthcare by improving diagnosis, treatment, accuracy, access to healthcare, and surgeries, hopefully while reducing errors and costs. To fully realize its benefits, we must ensure that it is fulfilled through clear rules and kind of make sure everyone is knowing what would actually be going on, and monitored still with ongoing human oversight. Balancing more advancements comes with caution and is crucial to avoid risks. So we definitely have to know about the disadvantages and know that there are some caution and risks that we would have to deal with, but like everything, we would get through that. And I think AI in healthcare would really, really help our world. So yeah, that is pretty much my whole research project. I really enjoyed learning more about this because I love healthcare, and AI, I think, is something that's really, really going to help in the long run. So thanks for watching.